I'm speaking with Wyoming Department of Health spokeswoman Kim Deti. Kim, you wanted to issue some clarifications, I guess, on communications involving local coronavirus cases that have been identified. Is that correct?
Yes, I would.
What would you like to what would you like to tell people?
Well, the first thing I'd like to do is make an observation that at the Wyoming Department of Health, we are always striving to balance between providing helpful information to people about health with also protecting privacy of patients. That's something we must do and we always do. But I want to talk a little bit about how notifications work, and it seems like some questions came up related to two cases of COVID-19 that were identified in Laramie County, one in the afternoon yesterday and one in the evening. So here's what happened. The first case from Laramie County in the afternoon was detected through testing run by the Wyoming Public Health Laboratory, which is part of the Wyoming Department of Health. When we got that result, we did exactly as we have done in the other counties where we've had cases. We informed the provider about it. We also, so that the patient can find out, of course. We also notify county health folks, and that did happen yesterday afternoon before any news release or announcement was issued from the Wyoming Department of Health. The county health was notified first, or actually, I shouldn't say first, before our release went out from the state. Then later in the day, the Wyoming Public Health Laboratory, actually into the night, because our folks are working really hard, they identified 3 more cases in Wyoming from the Public Health Laboratory, but at the same time, a private provider also got results from a private lab about one of their own patients. They notified us, as they're supposed to do, but in the meantime, before we were able to do notifications to county health or do our standard news release, the provider chose to share information about that second Laramie County case through social media. So they got the information before it was even provided to the state, and they made choice. That person or that provider made choices that we can't prevent. So that's unfortunate that there was some misunderstandings and folks that thought things might happen in some different ways. But here's some other information for people to know. At this point in time, and this has been changing all along, the Centers for Disease Control in Atlanta is not testing for us anymore. Most of the testing is being done at the Wyoming Public Health Laboratory. And this is different from the collection of a swab. The sample gets collected, then it gets sent to a lab for testing. Private labs are also doing some testing too. So things are different. It's not all coming through a straight chain from state to CDC to state and state then to county and then county down to city. That's just not how it's working anymore. That's not accurate.
So, Kim, what you're telling me in a nutshell is that the proper procedure was followed here on your end. Is that right?
The Wyoming Department of Health absolutely followed its proper procedures.
Okay.
And those are always meant to balance between sharing relevant public health information with people as well as protecting the privacy of patients, because we have a responsibility to do that too.